Question 1. To address the challenge of a client presenting with both a diagnosed opioid use disorder and significant symptoms of depression, which of the following approaches best reflects integrated treatment principles for co-occurring disorders within the IC and RC framework? Option A. Focus treatment efforts exclusively on the opioid use disorder, as it is the primary driver of the client's current crisis, and refer the client to a psychiatrist for separate management of their depression. Option B. Refer the client to two separate specialists, one for substance use and one for mental health, without establishing a clear communication protocol or unified treatment plan between them. Option C. Develop a comprehensive treatment plan that concurrently addresses both the opioid use disorder and the depressive symptoms, utilizing evidence-based interventions for each condition within a coordinated care model. Option D. Prioritize treatment for the depressive symptoms, assuming that once the client's mood improves, their substance use will naturally decrease, and defer specialized substance use disorder treatment. Correct answer is C. Develop a comprehensive treatment plan that concurrently addresses both the opioid use disorder and the depressive symptoms, utilizing evidence-based interventions for each condition within a coordinated care model. Explanation. This scenario is professionally challenging because it requires the counselor to navigate the complex interplay between two distinct yet interconnected conditions, a substance use disorder and a co-occurring mental health disorder. Effective treatment necessitates a comprehensive understanding of how these conditions influence each other, impacting symptom presentation, treatment engagement, and recovery trajectory. The counselor must move beyond treating each disorder in isolation and embrace an integrated approach that acknowledges their shared etiology and reciprocal impact. Correct approach represents best professional practice because it aligns with the core principles of integrated treatment for co-occurring disorders, which is the standard of care recognized by professional bodies and regulatory frameworks governing substance use disorder counseling. This approach prioritizes a holistic assessment that identifies all presenting problems, followed by the development of a unified treatment plan that addresses both disorders concurrently. This ensures that interventions are coordinated, evidence-based, and tailored to the individual's unique needs, maximizing the likelihood of successful outcomes and reducing the risk of relapse or exacerbation of either condition. Adherence to this integrated model is often a requirement for certification and licensure, ensuring counselors are competent in managing complex cases. An incorrect approach that focuses solely on the substance use disorder while neglecting the co-occurring mental health condition fails to meet the ethical and professional obligation to provide comprehensive care. This oversight can lead to incomplete treatment, as the underlying mental health issues may fuel substance use or hinder recovery efforts. From a regulatory perspective, this could be considered a breach of the duty of care, potentially violating standards that mandate addressing all significant client needs. Another incorrect approach that prioritizes the mental health disorder while minimizing or ignoring the substance use disorder is equally problematic. This can result in the client not receiving appropriate interventions for their addiction, leading to continued substance use, which can, in turn, destabilize their mental health. Ethically, this demonstrates a failure to recognize the severity and impact of the substance use disorder, potentially leading to harm. Regulatory frameworks often emphasize the need for specialized knowledge and skills in treating both substance use and mental health disorders when they co-occur, and failing to do so would be a violation. A third incorrect approach that suggests referring the client to separate specialists for each disorder without ensuring seamless coordination and communication between them is also professionally deficient. While collaboration is important, a fragmented approach can lead to conflicting treatment recommendations, gaps in care, and a lack of a unified strategy. This can undermine the client's trust and engagement in treatment. Ethically, the counselor retains responsibility for the overall care plan, and a lack of integration can be seen as an abdication of that responsibility. Regulatory bodies expect counselors to be able to manage or effectively coordinate care for co-occurring disorders, not simply to pass the client along without a cohesive plan. The professional reasoning framework for this situation involves a systematic process. First, conducting a thorough biopsychosocial spiritual assessment to identify all presenting problems, including the nature, severity, and interplay of substance use and mental health symptoms. Second, developing a unified, evidence-based treatment plan that integrates interventions for both disorders, considering the client's strengths, preferences, and readiness for change. Third, continuously monitoring the client's progress, adjusting the treatment plan as needed, and facilitating communication and collaboration among all involved professionals. Finally, advocating for the client's needs and ensuring they receive appropriate, coordinated care. Question 2. Governance review demonstrates that client, currently receiving counseling services, has verbally requested that their counselor share specific details of their treatment progress with a new therapist they intend to see. The counselor is aware of the client's intention to seek further support, but is unsure of the exact protocol for releasing this information. Option A. Release the requested information to the new therapist based on the client's verbal request, assuming implied consent due to the client seeking further professional help. Option B. Refuse to share any information with the new therapist, citing strict confidentiality policies, even if the client expresses a desire for continuity of care. Option C. Share a summary of the client's general progress with the new therapist without obtaining explicit consent, believing it is in the client's best interest for coordinated care. Option D. Obtain written, informed consent from the client detailing the specific information to be shared, with whom it will be shared, and the purpose of the sharing before releasing any information. The correct answer is D. Obtain written, informed consent from the client detailing the specific information to be shared, with whom it will be shared, and the purpose of the sharing before releasing any information. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent tension between a client's expressed desire for information and the counselor's legal and ethical obligations to protect client confidentiality. The counselor must navigate this delicate balance, recognizing that while fostering trust is crucial, breaching confidentiality without proper authorization can have severe legal and ethical repercussions. The challenge lies in upholding professional standards while responding to a client's request in a manner that respects their autonomy and the integrity of the therapeutic relationship. Correct approach analysis. The correct approach prioritizes obtaining explicit, informed consent from the client before releasing any information. This aligns directly with the core principles of confidentiality and privacy as mandated by IC and RC standards, which emphasize client autonomy and the protection of sensitive personal information. Obtaining written consent ensures that the client fully understands what information will be shared, with whom, and for what purpose, thereby empowering them to make an informed decision. This practice safeguards against unauthorized disclosure and upholds the ethical duty of care. Incorrect approaches analysis. One incorrect approach involves releasing information based solely on the client's verbal request without any documentation. This fails to meet the standard for informed consent, as it lacks a clear record of the client's authorization and understanding. Ethically, it creates ambiguity and a potential for misinterpretation or dispute regarding the scope of consent. Legally, it may not provide sufficient protection if a breach is alleged. Another incorrect approach is to assume that because the client is seeking assistance from another professional, implied consent for information sharing exists. This is a misinterpretation of confidentiality laws and ethical guidelines. Implied consent is generally not sufficient for the release of sensitive client information. Explicit, documented consent is required. This approach risks unauthorized disclosure and violates the client's right to control their personal data. A further incorrect approach is to refuse to share any information, even with explicit client consent, due to a generalized fear of violating confidentiality. While caution is warranted, an absolute refusal, even when authorized by the client, can undermine the therapeutic process and hinder continuity of care, which is often in the client's best interest. It fails to recognize that informed consent is a mechanism for appropriately managing and sharing information when the client directs it. Professional reasoning. Professionals should approach such situations by first reviewing the specific confidentiality policies and ethical codes applicable to their practice, as guided by the IC and RC framework. The decision-making process should involve 1. Identifying the client's request and the information sought. 2. Consulting relevant ethical codes and legal statutes regarding confidentiality and consent. 3. Engaging in a clear and open dialogue with the client about the implications of sharing information, including the purpose, scope, and recipients. 4. Obtaining explicit, written, and informed consent from the client, ensuring they understand their rights and the details of the disclosure. 5. Documenting the consent process and the information shared. If there is any doubt or ambiguity, seeking supervision or consultation is paramount. Question 3. Risk assessment procedures indicate a client has expressed a clear and specific intent to cause serious harm to a named individual. The counselor has a professional and ethical obligation to address this situation. Which of the following actions best upholds the counselor's ethical responsibilities according to IC and RC guidelines and common U.S. state regulations? Option A. Maintain strict confidentiality and focus solely on de-escalating the client's anger within the therapeutic session without external notification. Option B. Continue with the scheduled therapy session, assuming the client's statements are a manifestation of distress rather than a genuine threat. Option C. Consult with a supervisor about the situation and await their guidance before taking any further action. Option D. Immediately break confidentiality to warn the intended victim and notify law enforcement, documenting all actions taken. The correct answer is D. Immediately break confidentiality to warn the intended victim and notify law enforcement, documenting all actions taken. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the counselor's dual responsibility to maintain client confidentiality and to ensure the safety of others when a client expresses intent to harm. The counselor must navigate the complex ethical principle of confidentiality, which is not absolute, against the duty to warn or protect potential victims. The IC and RC Ethical Code, which aligns with common U.S. state licensing board regulations, emphasizes the importance of balancing these competing duties. Correct approach analysis. The correct approach involves a careful, documented assessment of the threat's imminence and specificity. This aligns with the ethical principle of beneficence, acting in the client's best interest, which includes their safety and non-maleficence, avoiding harm to others. When a client expresses a serious threat of harm to a specific person or group, the counselor has a legal and ethical obligation to take reasonable steps to protect the intended victim. This often involves breaking confidentiality to warn the potential victim and or notify law enforcement, as mandated by many state laws, e.g. Tarasoff duty in California, though specific requirements vary by state. The counselor must document all steps taken and the rationale behind them. Incorrect approaches analysis. Failing to assess the imminence and specificity of the threat and immediately breaking confidentiality without further evaluation is an overreach that violates the principle of fidelity and respect for client autonomy, as confidentiality is a cornerstone of the therapeutic relationship, can erode trust and potentially harm the therapeutic alliance unnecessarily. Continuing with therapy without any intervention, assuming the client's statements are not serious, directly violates the duty to protect and non-maleficence. This failure to act when a clear danger is present can have severe legal and ethical consequences, including potential liability for harm caused. Consulting with a supervisor without also taking immediate steps to assess and potentially act on the threat is insufficient if the threat is imminent and specific. While consultation is a vital part of ethical practice, it should not delay necessary protective actions when immediate danger is indicated. The counselor retains ultimate responsibility for their actions. Professional reasoning. Professionals should employ a decision-making framework that prioritizes client safety and the safety of others. This involves 1. Identifying the ethical principles at play: confidentiality, beneficence, non-maleficence, fidelity. 2. Assessing the nature and imminence of the threat. 3. Consulting relevant ethical codes and legal mandates, e.g., state laws regarding duty to warn/protect. 4. Documenting the assessment and decision-making process thoroughly. 5. Taking appropriate action, which may include breaking confidentiality, warning potential victims, and or notifying authorities, while minimizing the breach of confidentiality as much as possible. Question 4. The audit findings indicate that, while client feedback is occasionally solicited, there is inconsistency in how it is integrated into the ongoing adjustment of individual treatment plans. A counselor is working with a client who expresses dissatisfaction with a particular therapeutic activity, stating it feels unproductive and is causing them to disengage from sessions. Which of the following represents the most ethically sound and professionally effective approach to addressing this client feedback? Option A. The counselor should immediately remove the activity from the treatment plan and replace it with a new one suggested by the client, without further discussion or assessment. Option B. The counselor should document the client's feedback, but continue with the current treatment plan as designed, assuming the client's discomfort is a temporary resistance that will be overcome with time. Option C. The counselor should acknowledge the client's feelings, explore the reasons behind their dissatisfaction with the activity, and collaboratively discuss potential modifications or alternative strategies that align with treatment goals. Option D. The counselor should explain to the client that the activity is a standard component of the evidence-based protocol being followed and that adherence is necessary for progress, encouraging the client to push through their discomfort. Correct answer is D. The counselor should explain to the client that the activity is a standard component of the evidence-based protocol being followed and that adherence is necessary for progress, encouraging the client to push through their discomfort. Explanation. The audit findings indicate a need to review how client feedback is integrated into treatment plan adjustments. This scenario is professionally challenging because it requires balancing client autonomy and self-determination with the counselor's professional judgment and ethical obligations to provide effective care. Counselors must be responsive to client input without compromising the integrity or efficacy of the treatment plan, which is grounded in evidence-based practices and professional standards. The correct approach represents best professional practice because it prioritizes a collaborative and client-centered methodology. By actively soliciting, acknowledging, and discussing client feedback, the counselor demonstrates respect for the client's lived experience and their role as an active participant in their recovery. This approach aligns with ethical principles of informed consent and client empowerment, fostering a stronger therapeutic alliance. Adjusting the plan based on this feedback, after a professional assessment of its validity and impact on treatment goals, ensures the plan remains relevant and achievable for the client, thereby enhancing treatment outcomes. This is consistent with IC and RC's emphasis on client-centered care and the counselor's responsibility to adapt interventions to individual needs. An incorrect approach that dismisses client feedback outright represents a significant ethical failure. It disregards the client's perspective, potentially alienating them and undermining the therapeutic relationship. This can be seen as a violation of the principle of respect for persons and may lead to noncompliance with treatment, ultimately hindering progress. Ethically, it fails to uphold the counselor's duty to provide competent and relevant services. Another incorrect approach, which blindly implements every client suggestion without professional evaluation, also poses ethical risks. While appearing responsive, it can lead to a fragmented or ineffective treatment plan if the suggestions are not aligned with evidence-based practices or the client's core treatment goals. This could result in a failure to address the underlying issues effectively, potentially violating the counselor's duty to provide competent care and leading to a lack of progress or even harm. The professional decision-making process for similar situations involves a systematic approach. First, actively listen to and validate the client's feedback. Second, professionally assess the feedback in the context of the client's treatment goals, diagnosis, and evidence-based practices. Third, engage in a collaborative discussion with the client about the feedback, explaining the rationale behind any proposed adjustments or why certain suggestions might not be feasible or beneficial. Finally, document any agreed-upon modifications to the treatment plan and the rationale for those changes. This process ensures that client feedback is a valuable tool for enhancing treatment, rather than a source of conflict or compromise of professional standards. Question 5. Consider a scenario where a client in substance use disorder counseling expresses a desire to attend a social gathering where alcohol will be present, stating they feel confident they can manage their cravings and will not drink. The counselor has previously discussed relapse prevention strategies with the client, but this is the first time the client has explicitly requested to be in such a high-risk environment. Option A. Report the client's intention to attend the gathering to their family members without the client's explicit consent, believing it is necessary for their safety. Option B. Refuse the client's request outright, stating that attending such events is too risky for someone in their stage of recovery and that they should avoid all alcohol-related environments. Option C. Immediately agree to the client's request, trusting their stated confidence in managing cravings, and encourage them to go to the gathering. Option D. Engage in a detailed discussion with the client about the specific risks and benefits of attending the gathering. Explore alternative coping strategies for managing potential cravings in that environment, and collaboratively develop a plan for how the client will handle urges if they arise, while also discussing the importance of having a support person available and a predetermined exit strategy. The correct answer is D. Engage in a detailed discussion with the client about the specific risks and benefits of attending the gathering. Explore alternative coping strategies for managing potential cravings in that environment, and collaboratively develop a plan for how the client will handle urges if they arise, while also discussing the importance of having a support person available and a predetermined exit strategy. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's stated desire and the counselor's ethical obligation to ensure client well-being and safety, particularly when substance use is involved. The counselor must navigate the client's autonomy with their professional responsibility to prevent harm. Careful judgment is required to balance these competing interests while adhering to established ethical codes and legal mandates. The correct approach represents best professional practice because it prioritizes a thorough assessment of the client's capacity and the potential risks associated with their request. This aligns with the International Certification and Reciprocity Consortium, IC and RC ethical codes, which emphasize client welfare, informed consent, and the counselor's responsibility to avoid harm. By engaging in a detailed discussion about the risks and benefits, exploring alternative coping mechanisms, and documenting the process, the counselor upholds their duty of care and ensures that any decision made is in the client's best interest and is ethically sound. This approach also respects the client's autonomy by providing them with comprehensive information to make an informed decision, rather than making a unilateral judgment. An incorrect approach that involves immediately agreeing to the client's request without further assessment fails to uphold the counselor's duty of care. This bypasses the critical step of risk assessment and could lead to harm if the client's judgment is impaired by substance use or if the request itself poses a danger. Ethically, this violates the principle of non-maleficence, do no harm. Another incorrect approach, that of immediately refusing the request without exploration, disrespects client autonomy and may damage the therapeutic alliance. While the counselor has a responsibility to prevent harm, a blanket refusal without understanding the client's underlying needs or exploring alternatives can be paternalistic and counterproductive. This could also be seen as a failure to engage in a collaborative decision-making process, which is often a cornerstone of effective counseling. A third incorrect approach, that of reporting the client's request to a third party without exploring the situation further or obtaining consent, unless legally mandated due to imminent danger, violates client confidentiality and trust, which are fundamental ethical principles. Professionals should utilize a decision-making framework that begins with identifying the ethical dilemma. This is followed by gathering relevant information, including assessing the client's current state, understanding their motivations, and identifying potential risks and benefits. Next, professionals should consider the relevant ethical codes and legal requirements. Then, they should explore various courses of action, evaluating each against ethical principles and potential outcomes. Finally, the chosen course of action should be implemented and documented, with ongoing evaluation of its effectiveness and impact on the client. Question 6. The investigation demonstrates that a counselor, during a client intake, forms a strong initial impression of the client's substance use severity based on their demeanor and narrative. While the counselor is aware of several validated assessment instruments available for substance use disorders, they decide to proceed with developing a treatment plan based primarily on their clinical intuition and the client's stated desire for a specific type of therapy, without administering a standardized assessment. Which of the following actions best reflects adherence to IC and RC standards for assessment? Option A. Relying solely on the counselor's clinical intuition and the client's stated preferences to develop the treatment plan, as this approach is perceived as more client-centered and efficient. Option B. Documenting the counselor's initial impressions and the client's stated preferences as the sole basis for the treatment plan, omitting any mention of standardized assessment tools. Option C. Selecting a standardized assessment instrument that appears to align with the counselor's initial impression and using its results to confirm their pre-existing conclusions without further clinical consideration. Option D. Administering a validated, standardized assessment instrument to gather objective data and then integrating these findings with clinical observations and the client's expressed needs to inform the treatment plan. The correct answer is D. Administering a validated, standardized assessment instrument to gather objective data and then integrating these findings with clinical observations and the client's expressed needs to inform the treatment plan. Explanation. The investigation demonstrates a common ethical challenge in substance use disorder counseling, balancing the need for standardized, evidence-based assessment with the individual client's unique circumstances and the counselor's professional judgment. The IC and RC exam emphasizes the importance of using validated assessment instruments to ensure accurate diagnosis and appropriate treatment planning, aligning with ethical codes and regulatory standards that prioritize client welfare and professional accountability. The correct approach represents best professional practice because it prioritizes the ethical and regulatory imperative to use standardized assessment instruments while acknowledging the need for clinical judgment to interpret results within the client's context. This aligns with IC and RC's commitment to evidence-based practice and client-centered care. It ensures that assessment data is reliable and valid, forming a strong foundation for treatment, and that the counselor remains accountable for their professional decisions. An incorrect approach that relies solely on a subjective impression without utilizing a standardized instrument fails to meet the ethical and regulatory requirement for objective, evidence-based assessment. This can lead to misdiagnosis, inappropriate treatment, and potential harm to the client, violating principles of beneficence and non-maleficence. It also undermines professional accountability by bypassing established assessment protocols. Another incorrect approach that rigidly adheres to a standardized instrument score without considering contextual factors or clinical observations can lead to a decontextualized and potentially inaccurate understanding of the client's needs. This can result in a treatment plan that is not truly responsive to the individual, potentially causing frustration or disengagement for the client and failing to achieve optimal outcomes. It overlooks the counselor's ethical duty to provide individualized care. A further incorrect approach that involves fabricating or misrepresenting assessment data is a severe ethical and regulatory violation. This constitutes dishonesty and fraud, directly contravening the core ethical principles of integrity and trustworthiness essential for professional practice in substance use disorder counseling. Such actions erode client trust and damage the reputation of the profession. Professionals should employ a decision-making framework that begins with identifying the client's presenting concerns and the need for assessment. They should then select appropriate, validated assessment instruments that are culturally sensitive and relevant to the client's situation. The results of these instruments should be interpreted in conjunction with clinical observations, client self-report, and collateral information, always within the bounds of ethical practice and regulatory requirements. This integrated approach ensures a comprehensive and accurate understanding of the client, leading to effective and ethical treatment planning. Question 7. Upon reviewing a new client's intake, their family members express strong opinions about the client's rock bottom and insist that the client's substance use has reached a critical point requiring immediate, intensive intervention, even before the client has fully elaborated on their personal experiences and the counselor has completed a comprehensive assessment. Which of the following approaches best aligns with IC and RC assessment and diagnosis standards in this situation? Option A. Dismiss the family's input entirely, as the assessment should only consider information directly provided by the client. Option B. Prioritize the client's self-report and the counselor's direct assessment findings, while acknowledging the family's concerns and exploring their perspective within ethical boundaries. Option C. Immediately accept the family's narrative as the definitive description of the client's rock bottom and proceed with a diagnosis based solely on their input. Option D. Allow the family's insistence on a specific diagnosis to guide the counselor's diagnostic formulation, overriding the client's own account if there are discrepancies. The correct answer is B. Prioritize the client's self-report and the counselor's direct assessment findings, while acknowledging the family's concerns and exploring their perspective within ethical boundaries. Explanation. Scenario analysis. This scenario presents a professional challenge because the counselor is faced with conflicting information from a client's family regarding the client's substance use history. The family's perception of the client's rock bottom may be influenced by their own biases or a desire for the client to enter treatment, potentially leading to an incomplete or inaccurate picture. The counselor must navigate this situation while upholding the client's autonomy and the principles of ethical assessment, ensuring that the diagnosis is based on the client's self-report and objective assessment findings, not solely on external pressures or interpretations. Correct approach analysis. The correct approach involves prioritizing the client's self-report and the counselor's direct assessment findings. This aligns with IC and RC's emphasis on client-centered care and the ethical imperative to conduct a thorough and objective assessment. The IC and RC standards require counselors to gather information from multiple sources when appropriate, but the ultimate diagnostic formulation must be grounded in the data collected directly from the client and through the counselor's professional judgment, respecting client confidentiality and the right to self-determination. Relying on the client's narrative and the counselor's clinical observations ensures the assessment is as accurate and unbiased as possible, forming the foundation for an effective treatment plan. Incorrect approaches analysis. One incorrect approach is to immediately accept the family's narrative as definitive and base the assessment solely on their description of the client's rock bottom. This fails to respect the client's autonomy and right to self-determination, which are core ethical principles in substance use counseling. It also bypasses the counselor's professional responsibility to conduct an independent assessment, potentially leading to an inaccurate diagnosis and an inappropriate treatment plan. This approach risks alienating the client and undermining the therapeutic alliance. Another incorrect approach is to dismiss the family's input entirely without attempting to understand their perspective or how it might inform the assessment. While the client's self-report is paramount, families can sometimes provide valuable context or observations that, when corroborated, can enhance the assessment. Ignoring them completely could be a missed opportunity for a more comprehensive understanding and could create unnecessary conflict with the client's support system. A third incorrect approach is to allow the family's insistence on a specific diagnosis to unduly influence the counselor's professional judgment. This compromises the integrity of the assessment process and violates the ethical standard of maintaining objectivity. The counselor's role is to diagnose based on evidence and clinical expertise, not to conform to external pressures or predetermined conclusions, regardless of the source. Professional reasoning. Professionals should approach such situations by first acknowledging the family's concerns and seeking to understand their perspective in a way that respects client confidentiality. They should then clearly communicate to the family the importance of the client's self-report and the counselor's direct assessment informing a diagnosis. The counselor must then conduct a comprehensive assessment, integrating information from the client, and if permissible and beneficial, from collateral sources, while maintaining professional objectivity and prioritizing the client's well-being and autonomy. The decision-making process involves weighing the reliability and validity of all information, adhering to ethical codes, and ensuring the diagnostic process is client-centered and evidence-based. Question 8. Market research demonstrates that clients often express preferences for specific relapse prevention strategies early in treatment. A counselor is working with a client who has recently expressed a strong desire to focus exclusively on mindfulness techniques to prevent relapse. The counselor has conducted an initial intake, but has not yet completed a comprehensive risk assessment. What is the most appropriate next step for the counselor in developing the client's relapse prevention plan? Option A. Focus solely on identifying and addressing the client's most prominent substance use trigger, as this is likely the primary driver of relapse. Option B. Provide the client with a generic relapse prevention workbook that outlines common strategies, allowing them to choose the techniques they feel are most relevant. Option C. Immediately incorporate mindfulness techniques into the relapse prevention plan as requested by the client, assuming this will be the most motivating approach. Option D. Conduct a comprehensive risk assessment to identify the client's unique triggers, high-risk situations, and coping deficits before collaboratively developing a tailored relapse prevention plan. The correct answer is D. Conduct a comprehensive risk assessment to identify the client's unique triggers, high-risk situations, and coping deficits before collaboratively developing a tailored relapse prevention plan. Explanation. This scenario is professionally challenging because it requires the counselor to balance the client's immediate expressed desire for a specific relapse prevention strategy with the counselor's ethical and regulatory obligation to conduct a thorough risk assessment. The IC and RC's emphasis on client-centered care must be integrated with evidence-based practices and a commitment to client safety, which necessitates a comprehensive understanding of the client's individual risk factors. The correct approach represents best professional practice because it aligns with the IC and RC's core competencies and ethical standards, particularly those related to assessment and treatment planning. A thorough risk assessment is foundational to developing an effective and individualized relapse prevention plan. It ensures that the plan addresses the client's unique triggers, coping deficits, and high-risk situations, thereby increasing the likelihood of sustained recovery. This approach prioritizes client well-being and safety by proactively identifying and mitigating potential relapse pathways, which is a direct reflection of the counselor's duty of care. An incorrect approach that bypasses a comprehensive risk assessment in favor of a client's initial suggestion fails to uphold the counselor's professional responsibility. This could lead to an ineffective plan that does not adequately address the client's specific vulnerabilities, potentially increasing their risk of relapse. Ethically, this represents a failure to provide competent and individualized care. From a regulatory standpoint, it may violate standards that mandate thorough assessment before treatment planning. Another incorrect approach, focusing solely on a single relapse trigger without exploring the broader context of the client's life and potential stressors, is also professionally deficient. This narrow focus ignores the complex interplay of factors that contribute to relapse and can result in a superficial plan. It demonstrates a lack of comprehensive understanding of the client's recovery journey and may not equip them with the necessary skills to navigate diverse high-risk situations. Finally, an approach that relies on generic relapse prevention techniques without tailoring them to the client's specific needs and circumstances is inadequate. While general strategies can be helpful, their effectiveness is significantly enhanced when they are personalized. Failing to conduct a thorough assessment to inform this personalization can lead to a plan that feels irrelevant or unmanageable for the client, undermining their engagement and the plan's efficacy. This can be seen as a failure to provide individualized and evidence-based services, which are cornerstones of ethical and effective substance use disorder counseling. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and validate the client's input and preferences. 2. Clearly articulate the necessity of a comprehensive risk assessment as a prerequisite for developing an effective relapse prevention plan, explaining how it benefits the client. 3. Conduct a thorough assessment that explores personal history, substance use patterns, environmental factors, psychological states, and social support systems. 4. Collaboratively develop the relapse prevention plan, integrating assessment findings with the client's goals and preferences. 5. Regularly review and revise the plan based on the client's progress and evolving needs. Question 9. Examination of the data shows that a substance use disorder counselor is considering a novel therapeutic approach that has gained recent popularity within certain professional circles, but lacks extensive peer-reviewed research supporting its efficacy in long-term recovery outcomes. The counselor is under pressure to demonstrate significant client progress. Which of the following actions best aligns with the principles of evidence-based practice as expected by the International Certification and Reciprocity Consortium, IC and RC framework? Option A. Adopt the novel therapeutic approach, but only if it can be implemented with minimal additional resources or training, regardless of its research backing. Option B. Prioritize interventions with a strong foundation of empirical research and documented effectiveness in treating substance use disorders, even if they are not the newest or most popular methods. Option C. Implement the novel therapeutic approach immediately due to its popularity, assuming that widespread adoption implies inherent effectiveness. Option D. Rely primarily on personal clinical intuition and anecdotal reports of success with similar clients when selecting treatment modalities. Correct answer is B. Prioritize interventions with a strong foundation of empirical research and documented effectiveness in treating substance use disorders, even if they are not the newest or most popular methods. Explanation. Scenario analysis. This scenario presents a common challenge in substance use disorder treatment, balancing the desire for rapid client progress with the ethical and regulatory imperative to utilize evidence-based practices. The counselor faces pressure to demonstrate positive outcomes, potentially leading to the temptation to adopt less rigorously tested or even anecdotal interventions. The professional challenge lies in discerning between promising new techniques and those with established efficacy, ensuring client welfare and adherence to professional standards. Correct approach analysis. The correct approach prioritizes interventions with documented efficacy through rigorous research. Aligning with IC and RC's emphasis on evidence-based practices. This ensures that clients receive treatment that has been shown to be effective, maximizing their chances of recovery and minimizing potential harm from unproven methods. Adhering to EBPs is a core ethical responsibility, safeguarding client well-being and upholding the integrity of the profession. This approach directly supports the IC and RC's commitment to promoting effective and ethical substance use disorder treatment. Incorrect approaches analysis. One incorrect approach involves relying solely on personal clinical experience or anecdotal success stories without consulting research. This fails to meet the EBP standard because individual experiences, while valuable, are not systematically validated and may not generalize to other clients or populations. This can lead to the use of ineffective or even harmful interventions, violating the ethical duty to provide competent care and potentially contravening IC and RC standards that mandate the use of empirically supported treatments. Another incorrect approach is adopting a new, unproven intervention simply because it is popular or promoted by a vendor, without independent verification of its efficacy. This prioritizes novelty or marketability over client benefit and scientific validity. Such an approach risks exposing clients to treatments that have not demonstrated effectiveness, potentially delaying or hindering their recovery, and represents a failure to adhere to the rigorous standards of evidence required by IC and RC. A third incorrect approach is to dismiss interventions that have strong research support because they are perceived as too time-consuming or resource-intensive to implement. While practical considerations are important, the primary ethical obligation is to provide the most effective care. Neglecting EBPs due to implementation challenges, without exploring feasible adaptations or seeking necessary resources, constitutes a failure to prioritize client outcomes and can be seen as a deviation from professional responsibility and IC and RC guidelines. Professional reasoning. Professionals should approach treatment planning by first identifying the client's specific needs and then systematically researching interventions with documented efficacy for those needs. This involves consulting peer-reviewed literature, professional guidelines, and reputable databases of EBPs. When considering new or emerging interventions, a critical evaluation of the available research is essential, looking for replication, control groups, and statistically significant outcomes. If an intervention lacks robust evidence, it should be used cautiously, perhaps as an adjunct to established EBPs, and with ongoing monitoring of client progress and a willingness to discontinue if ineffective. Collaboration with supervisors and colleagues and engagement in continuing education are vital for staying abreast of current EBP research and best practices. Question 10. Performance analysis shows that a counselor is working with a client presenting with complex substance use and co-occurring mental health issues. The counselor has administered a standardized screening tool for substance use and has conducted an initial intake interview. To ensure a thorough understanding of the client's needs and to develop an effective treatment plan, which of the following approaches to assessment is most aligned with best professional practice according to IC and RC guidelines? Option A. Integrating findings from the standardized screening tool, the clinical interview, and seeking consent to gather relevant collateral information from the client's primary care physician. Option B. Obtaining a detailed history from the client's family members, as they often have a clearer understanding of the client's challenges than the client themselves. Option C. Focusing exclusively on the client's self-reported symptoms during the intake interview, as their perspective is paramount. Option D. Relying primarily on the results of the standardized screening tool, assuming it accurately reflects the full scope of the client's substance use disorder. The correct answer is A. Integrating findings from the standardized screening tool, the clinical interview, and seeking consent to gather relevant collateral information from the client's primary care physician. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the counselor to move beyond a single assessment tool and integrate multiple sources of information to form a comprehensive understanding of the client's needs. Relying solely on one method risks misinterpretation, incomplete data, and potentially inappropriate treatment planning, which can negatively impact client outcomes and violate professional standards of care. Correct approach analysis. The correct approach involves utilizing a variety of assessment tools and techniques, such as standardized instruments, clinical interviews, and collateral information, to triangulate data and build a robust profile of the client. This aligns with IC and RC's emphasis on comprehensive client assessment, which necessitates gathering information from multiple perspectives to ensure accuracy and validity. This multi-method approach supports evidence-based practice and promotes a client-centered treatment plan that addresses the full spectrum of their challenges and strengths. Incorrect approaches analysis. One incorrect approach is to solely rely on a single, standardized assessment tool. This fails to capture the nuances of an individual's experience, potentially overlooking critical factors not measured by that specific instrument. Ethically, this can lead to a violation of the principle of beneficence by not providing the most accurate and complete assessment possible, thereby hindering effective treatment. Another incorrect approach is to prioritize subjective client self-reporting without corroboration from other sources. While client perspective is vital, it can be influenced by various factors, including insight, memory, or desire to present in a certain way. Without incorporating objective data or collateral information, the assessment may be skewed, leading to an incomplete or inaccurate understanding of the client's situation, which is a failure in due diligence. A third incorrect approach is to exclusively use collateral information without direct client engagement. This bypasses the client's own voice and experience, potentially leading to biased interpretations or the collection of information that is not relevant to the client's current needs or goals. This approach can violate client confidentiality and autonomy if not handled with extreme care and consent, and it fails to establish a therapeutic alliance built on direct communication. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the client's presenting problem and goals. This is followed by selecting appropriate assessment tools that are validated, culturally sensitive, and relevant to the presenting issues. The process involves systematically collecting data from multiple sources, critically analyzing the findings for consistency and discrepancies, and integrating this information into a holistic understanding of the client. Finally, this comprehensive assessment informs the development of a collaborative and individualized treatment plan. Question 11. The performance metrics show a slight increase in client engagement with treatment plans that offer more collaborative goal setting. A counselor is working with a client who has expressed a desire to discontinue a specific, evidence-based therapeutic modality that the counselor believes is crucial for the client's progress in addressing their substance use disorder. The client states they do not feel the modality is effective for them and wishes to explore alternative, less evidence-based approaches. The counselor has explained the rationale for the current modality, its documented benefits, and potential risks of discontinuing it prematurely, but the client remains firm in their decision. What is the most ethically sound course of action for the counselor? Option A. Insist that the client continue with the current therapeutic modality, citing the evidence of its effectiveness and the potential negative consequences of discontinuing it, to ensure the client receives the best possible care. Option B. Proceed with the client's preferred alternative approaches without further discussion, assuming the client's autonomy supersedes any professional recommendation, to avoid conflict. Option C. Respect the client's decision to discontinue the current modality, document the discussion thoroughly, and collaboratively explore alternative approaches that align with the client's stated preferences and goals, while continuing to educate on the importance of evidence-based practices. Option D. Immediately terminate the therapeutic relationship due to the client's noncompliance with the recommended treatment plan, as this indicates a lack of commitment to recovery. The correct answer is C. Respect the client's decision to discontinue the current modality, document the discussion thoroughly, and collaboratively explore alternative approaches that align with the client's stated preferences and goals, while continuing to educate on the importance of evidence-based practices. Explanation. This scenario is professionally challenging because it requires balancing the counselor's professional judgment regarding a client's well-being with the client's fundamental right to self-determination and informed consent. The counselor must navigate the ethical imperative to protect the client from harm while respecting their autonomy, even when the client's choices may seem detrimental. The IC and RC's ethical standards, which are foundational for this exam, emphasize client autonomy and the process of informed consent as cornerstones of the therapeutic relationship. The correct approach represents best professional practice because it prioritizes the client's right to make informed decisions about their treatment. This involves a thorough and ongoing process of providing clear, understandable information about the risks, benefits, and alternatives to proposed interventions. It respects the client's capacity to understand this information and to make a choice free from coercion or undue influence. This aligns directly with IC and RC's emphasis on client self-determination and the ethical obligation to ensure clients are active participants in their own care. An incorrect approach that involves overriding the client's stated wishes without a clear, documented, and ethically justifiable reason, such as imminent danger to self or others, which is not indicated here, represents a failure to uphold the principle of client autonomy. This can lead to a breach of trust, damage the therapeutic alliance, and violate ethical codes that mandate respect for client self-determination. Another incorrect approach, such as proceeding with a treatment plan without ensuring the client fully understands the implications, is a failure of the informed consent process. This can result in the client feeling disempowered, coerced, or that their rights have been violated, leading to potential ethical complaints and a breakdown in the professional relationship. Professionals should employ a decision-making framework that begins with assessing the client's capacity to understand and consent. This involves clear communication, using language the client can comprehend, and actively checking for understanding. If there are concerns about capacity, the professional should explore these further, potentially involving others if appropriate and with client consent. The process should be iterative, allowing for questions and reassurances. If a client refuses a recommended course of action, the professional should explore the reasons for refusal, re-explain the rationale for the recommendation, and discuss alternative options that align with the client's goals and values, always documenting the discussion and the client's decision. Question 12. Analysis of a counselor working with a client who discloses a history of severe child abuse experienced in their childhood. The client expresses significant emotional distress and fear of repercussions if this information becomes known. The counselor is aware of their mandated reporter status in their jurisdiction. What is the most ethically and legally sound immediate course of action for the counselor? Option A. Focus solely on the client's immediate emotional distress and therapeutic needs, deferring any reporting considerations until the client is more stable. Option B. Directly contact Child Protective Services to file a report without consulting a supervisor to ensure promptness. Option C. Delay reporting to gather more details from the client and to avoid causing them further distress, explaining the reporting process later. Option D. Immediately consult with a supervisor and review relevant state statutes and IC and RC ethical guidelines regarding child abuse reporting before taking further action. Correct answer is D. Immediately consult with a supervisor and review relevant state statutes and IC and RC ethical guidelines regarding child abuse reporting before taking further action. Explanation. This scenario presents a professional challenge due to the counselor's dual role as a trusted advisor and a mandated reporter, creating a potential conflict of interest and impacting the therapeutic alliance. The client's disclosure of past child abuse, while a sign of trust, also triggers legal and ethical obligations for the counselor. Careful judgment is required to balance the client's immediate emotional needs with the counselor's duty to protect potential victims and adhere to reporting laws. The correct approach represents best professional practice because it prioritizes client safety and legal compliance. By immediately consulting with a supervisor and reviewing relevant state statutes and IC and RC ethical guidelines regarding child abuse reporting, the counselor ensures a legally sound and ethically responsible course of action. This proactive step demonstrates adherence to the principle of beneficence acting in the client's best interest, which includes safety and non-maleficence, avoiding harm, which could occur if reporting is delayed or mishandled. It also upholds the counselor's professional integrity and commitment to ethical standards. An incorrect approach that involves delaying the report to gather more information or to avoid upsetting the client fails to recognize the urgency and legal mandate of child abuse reporting. This delay constitutes a regulatory and ethical failure because it potentially puts a child at risk and violates the counselor's duty to report suspected abuse promptly as required by law. Such a delay can also erode client trust if the client later learns of the counselor's inaction or if the situation escalates due to the delay. Another incorrect approach, such as directly reporting to the authorities without consulting a supervisor or reviewing specific reporting protocols, while seemingly prompt, may be procedurally flawed. This could lead to incomplete or inaccurate reporting, potentially causing undue distress to the client, or failing to meet specific jurisdictional requirements for reporting. thus representing a regulatory and ethical failure in proper procedure. A further incorrect approach, such as attempting to counsel the client through the reporting process without first ensuring legal compliance and understanding the reporting requirements, risks compromising the therapeutic relationship and the effectiveness of the intervention. While client support is crucial, it must be grounded in a foundation of ethical and legal adherence. The professional decision-making process for similar situations should involve a clear, multi-step approach. 1. Recognize the ethical and legal implications of the client's disclosure. 2. Immediately consult with a supervisor or experienced colleague to discuss the situation and potential courses of action. 3. Review relevant professional codes of ethics, e.g., IC and RC, and state-specific laws and regulations pertaining to mandated reporting. 4. Determine the most appropriate and legally compliant intervention, balancing client welfare with legal obligations. 5. Document all consultations, decisions, and actions taken. Question 13. Stakeholder feedback indicates that a client in substance use disorder counseling, who has been sober for 6 months, is expressing a strong desire to resume social activities that involve environments where substance use is prevalent. The client explicitly states they do not want their family involved in their treatment decisions or informed about these specific social plans, citing a desire for independence. The counselor is concerned that these social engagements significantly increase the risk of relapse. What is the most appropriate course of action for the counselor? Option A. Immediately inform the client's family about the client's social plans and the counselor's concerns, as the client's safety is paramount. Option B. Discuss the client's concerns and the potential risks with a supervisor. Explore strategies to support the client's sobriety in these environments, and collaboratively develop a relapse prevention plan that respects the client's autonomy while addressing safety concerns. Option C. Directly contact the client's family to discuss the situation and seek their intervention without first consulting with the client or a supervisor. Option D. Respect the client's wishes for independence and allow them to proceed with their social plans without further intervention, as the client has maintained sobriety for 6 months. The correct answer is B. Discuss the client's concerns and the potential risks with a supervisor, explore strategies to support the client's sobriety in these environments, and collaboratively develop a relapse prevention plan that respects the client's autonomy while addressing safety concerns. Explanation. This scenario presents a professional challenge due to the conflict between a client's expressed wishes and the counselor's ethical obligation to ensure the client's safety and well-being, particularly when substance use is involved. The counselor must navigate the complexities of client autonomy, confidentiality, and the duty to protect, all within the framework of IC and RC standards for professional conduct and accountability. The correct approach prioritizes client safety and adherence to professional ethical guidelines. By seeking consultation with a supervisor and exploring options that balance client autonomy with risk mitigation, the counselor demonstrates accountability and a commitment to best practices. This aligns with IC and RC's emphasis on ethical decision-making, seeking supervision when facing complex ethical dilemmas, and acting in the best interest of the client while respecting their rights. The counselor's actions reflect a proactive and responsible approach to a potentially dangerous situation. An incorrect approach that involves immediately disclosing the client's information without exploring less intrusive options or seeking guidance violates the principle of confidentiality, a cornerstone of professional practice and often a specific requirement within IC and RC standards. This action could erode client trust and potentially lead to negative consequences for the client's treatment engagement. Another incorrect approach, that of ignoring the client's stated desire to avoid involving family while seemingly respecting autonomy, fails to adequately address the potential risks associated with the client's substance use and the impact on their safety. This inaction could be seen as a dereliction of the counselor's duty of care and accountability for client well-being, especially if the substance use poses a significant risk. A further incorrect approach that involves directly confronting the family without the client's consent or prior consultation with a supervisor breaches confidentiality and potentially escalates the situation without a structured, ethical plan. This bypasses established protocols for handling such sensitive matters and could jeopardize the therapeutic relationship and the client's progress. The professional decision-making process for similar situations should involve a systematic ethical analysis. This includes identifying the ethical dilemma, consulting relevant professional codes of conduct, such as those outlined by IC and RC, seeking supervision or consultation with peers, exploring all available options, weighing the potential benefits and harms of each option, and documenting the decision-making process and the final course of action. The focus should always be on maintaining client welfare, respecting client rights, and upholding professional integrity. Question 14. The risk matrix shows a client presenting with passive suicidal ideation, a stated desire to die, but no specific plan or intent to act on these thoughts in the immediate future. The client expresses a desire to continue therapy to work through their distress. What is the most appropriate initial course of action for the counselor? Option A. Immediately initiate involuntary hospitalization procedures due to the stated desire to die, regardless of the absence of a specific plan or intent. Option B. Collaborate with the client to develop a comprehensive safety plan, including identifying coping strategies, support systems, and steps to reduce access to potential means, while continuing regular therapeutic sessions. Option C. Document the suicidal ideation in the client's chart and schedule a follow-up appointment for the following week, assuming the lack of immediate plan indicates low risk. Option D. Advise the client that suicidal ideation without a plan is not a priority for intervention, and encourage them to seek help only if the situation escalates significantly. The correct answer is B. Collaborate with the client to develop a comprehensive safety plan, including identifying coping strategies, support systems, and steps to reduce access to potential means, while continuing regular therapeutic sessions. Explanation. This scenario is professionally challenging because it requires the counselor to balance immediate safety concerns with the client's autonomy and the need for ongoing therapeutic engagement. The counselor must accurately assess the level of risk presented by the client's suicidal ideation and plan, while also considering the client's willingness and capacity to engage in safety planning. The IC and RC framework emphasizes a client-centered approach that respects individual rights and promotes self-determination, but this must be balanced with the ethical and legal duty to protect life when a serious risk of harm is present. The correct approach represents best professional practice because it involves a comprehensive risk assessment that moves beyond simply identifying suicidal thoughts to evaluating the imminence and lethality of the risk. This includes exploring the client's intent, means, and access to those means, as well as protective factors. Collaborating with the client to develop a safety plan, which may include identifying coping strategies, support system, and steps to reduce access to lethal means, is a cornerstone of effective crisis intervention and risk management within the IC and RC guidelines. This approach respects the client's agency while ensuring appropriate safety measures are in place, aligning with ethical principles of beneficence and non-maleficence. An incorrect approach that focuses solely on immediate hospitalization without a thorough assessment of the client's current capacity and willingness to engage in safety planning fails to uphold the principle of least restrictive intervention. While hospitalization may be necessary in some cases, it should not be the default response without exploring less restrictive alternatives that can empower the client and maintain the therapeutic alliance. This approach could be perceived as paternalistic and may alienate the client, potentially leading to disengagement from services. Another incorrect approach that involves simply documenting the suicidal ideation without actively engaging in a risk assessment and safety planning process constitutes a significant ethical and potentially legal failure. This inaction neglects the counselor's duty to protect and could have severe consequences. It violates the core tenets of crisis intervention, which demand proactive engagement and intervention when a client is at risk. Finally, an approach that dismisses the client's suicidal ideation due to a perceived lack of immediate intent or plan, without a thorough exploration of underlying stressors and potential escalation, is also professionally unsound. Suicidal ideation, even if not immediately lethal, requires careful attention and assessment, as it can be an indicator of significant distress and a precursor to more serious risk. This approach fails to adequately address the client's suffering and the potential for future harm. Professionals should utilize a structured decision-making process that begins with a comprehensive assessment of the presenting problem, including the client's risk factors and protective factors. This assessment should inform the development of an intervention plan that is tailored to the individual client's needs and circumstances, prioritizing safety while respecting autonomy. Regular reassessment and documentation are crucial throughout the crisis intervention process. Question 15. Research into effective treatment planning for individuals with co-occurring substance use and mental health disorders reveals that clients often express strong preferences for certain therapeutic modalities. A clinician is working with a client who has a diagnosis of opioid use disorder and major depressive disorder. The client expresses a strong desire to focus solely on counseling that addresses their immediate cravings and emotional distress, while minimizing any discussion of past trauma or the underlying psychological factors contributing to their substance use. The clinician, based on their assessment and knowledge of evidence-based practices for co-occurring disorders, believes that addressing past trauma and developing coping mechanisms for emotional regulation are critical for long-term recovery and relapse prevention. What is the most appropriate approach for the clinician to take in developing the treatment plan? Option A. Immediately implement a treatment plan that focuses exclusively on counseling for immediate cravings and emotional distress, as requested by the client, to build rapport and ensure their engagement. Option B. Defer to the client's request and develop a treatment plan solely focused on immediate cravings and emotional distress, without further exploration of trauma or underlying psychological factors, to avoid alienating them. Option C. Collaboratively discuss the client's expressed preferences with them, explaining the clinical rationale for incorporating trauma-informed care and emotional regulation strategies into the treatment plan, and work together to find a balance that respects their immediate needs while addressing foundational issues. Option D. Insist on a treatment plan that prioritizes trauma processing and emotional regulation techniques from the outset, explaining to the client that these are non-negotiable components for effective treatment. The correct answer is C. Collaboratively discuss the client's expressed preferences with them, explaining the clinical rationale for incorporating trauma-informed care and emotional regulation strategies into the treatment plan, and work together to find a balance that respects their immediate needs while addressing foundational issues. Explanation. This scenario presents a common implementation challenge in substance use disorder treatment planning, balancing client autonomy with the need for evidence-based interventions and professional judgment. The challenge lies in navigating a client's expressed preferences, which may be influenced by their current stage of change or a desire for immediate gratification, against the clinician's expertise regarding effective treatment pathways for their specific diagnosis and history. Professional judgment requires assessing the client's readiness for change, potential risks associated with certain choices, and the likelihood of achieving treatment goals. The correct approach represents best professional practice because it prioritizes a collaborative yet informed treatment planning process. It involves actively listening to the client's desires and concerns, validating their feelings, and then integrating this information with clinical assessment and knowledge of effective interventions. This approach aligns with ethical principles of client-centered care and respect for autonomy, while also upholding the professional responsibility to guide clients toward pathways most likely to lead to recovery and well-being. It ensures that the treatment plan is not only accepted by the client, but also clinically sound and tailored to their needs, fostering engagement and improving outcomes. This is consistent with IC and RC core competencies, which emphasize client engagement and the development of individualized treatment plans. An incorrect approach that solely defers to the client's immediate wishes without clinical assessment or guidance fails to uphold the professional's duty of care. This could lead to a treatment plan that is ineffective, potentially harmful, or does not address the underlying issues contributing to the substance use disorder. Ethically, this is a failure to exercise professional judgment and could be seen as a dereliction of duty. Another incorrect approach that rigidly imposes a treatment plan without adequate client input or consideration of their preferences, even if deemed best by the clinician, undermines client engagement and autonomy. This can lead to resistance, noncompliance, and a breakdown in the therapeutic alliance, violating principles of informed consent and client participation in their own care. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's needs, strengths, and preferences. This is followed by a discussion of evidence-based treatment options, outlining the rationale, potential benefits, and risks of each. The clinician then collaborates with the client to develop a mutually agreed-upon treatment plan that respects the client's autonomy, while ensuring it is clinically appropriate and addresses the identified problems. Ongoing review and adjustment of the plan based on client progress and feedback are also crucial components of this process. Question 16. The monitoring system demonstrates a pattern of missed appointments by a client in a substance use disorder treatment program. The counselor has documented the missed appointments and attempted to contact the client via phone and email without success. The client has a history of sporadic engagement, but has expressed a desire to maintain sobriety. What is the most appropriate next step for the counselor to take? Adhering to IC and RC ethical standards and U.S. federal regulations governing substance use disorder treatment. Option A. Contact the client's emergency contact to inform them of the missed appointments and request their assistance in ensuring the client attends future sessions. Option B. Schedule a meeting with the client to discuss the missed appointments and collaboratively develop a plan to address any barriers to attendance, while documenting all efforts and the outcome of the discussion. Option C. Immediately terminate services due to non-compliance with the treatment schedule, as per agency policy for repeated missed appointments. Option D. Refer the client to a higher level of care without further discussion, assuming the current level of treatment is not meeting their needs due to their attendance issues. The correct answer is B. Schedule a meeting with the client to discuss the missed appointments and collaboratively develop a plan to address any barriers to attendance, while documenting all efforts and the outcome of the discussion. Explanation. The monitoring system demonstrates a pattern of missed appointments by a client in a substance use disorder treatment program. This scenario is professionally challenging because it requires balancing the client's right to privacy and autonomy with the agency's responsibility to provide effective treatment and ensure client safety, all within the strict confines of IC and RC ethical standards and relevant U.S. federal and state regulations governing substance use disorder treatment. The core tension lies in how to respond to non-compliance without violating confidentiality or prematurely terminating services that might be crucial for the client's recovery. The correct approach involves a structured, client-centered intervention that prioritizes engagement and problem-solving. This aligns with IC and RC ethical principles emphasizing client welfare, informed consent, and the counselor's responsibility to facilitate client progress. Specifically, it adheres to the principle of respecting client rights while also addressing potential barriers to treatment. Documenting the missed appointments and the subsequent outreach efforts is crucial for accountability and continuity of care. The subsequent discussion with the client to understand the reasons for missed appointments and collaboratively develop a plan to address these barriers is the most ethical and effective way to proceed. This approach respects the client's agency, seeks to identify and mitigate obstacles to treatment, and maintains the therapeutic alliance, all while adhering to professional standards of care and documentation. An incorrect approach would be to immediately terminate services without attempting to understand the reasons for the missed appointments or offering support. This fails to uphold the ethical obligation to promote client well-being and recovery. It also risks alienating the client and potentially leading to a relapse or disengagement from all services. Another incorrect approach would be to disclose the client's attendance issues to a third party without explicit, informed consent, violating strict confidentiality regulations such as 42 CFR Part 2 and HIPAA. This would be a severe breach of trust and a violation of legal and ethical mandates. A third incorrect approach might be to ignore the missed appointments, assuming the client will re-engage on their own. This demonstrates a lack of professional diligence and a failure to actively manage the treatment process, potentially jeopardizing the client's progress and the effectiveness of the program. Professionals should employ a decision-making framework that begins with assessing the situation, considering the client's history and current circumstances, and then consulting relevant ethical codes, IC and RC, and legal regulations. The framework should prioritize open communication with the client, collaborative problem-solving, and documentation of all interventions. When faced with noncompliance, the process should involve 1. Documenting the observed behavior. 2. Attempting to contact the client to understand the reasons. 3. Collaboratively developing a plan to address barriers. 4. Documenting the plan and any agreed-upon consequences. And 5. If necessary, following established agency protocols for service termination, always prioritizing client safety and continuity of care. Question 17. Operational review demonstrates that while the agency has established broad goals for client recovery and counselor professional development, the process for translating these into specific, measurable objectives for individual counselors is inconsistent and often lacks clear metrics for success. Which of the following approaches best addresses this implementation challenge while adhering to professional standards for substance use disorder counseling? Option A. Establish aspirational, long-term goals for client recovery that emphasize hope and motivation, without defining specific intermediate steps or measurable benchmarks, to avoid placing undue pressure on counselors and clients. Option B. Implement a system where counselors self-report their perceived contributions to client recovery and professional growth, with these subjective assessments serving as the primary basis for objective setting and performance evaluation. Option C. Focus on increasing the volume of services provided by counselors, such as the number of individual counseling sessions and group facilitation hours, as a direct measure of their effectiveness and commitment to client care. Option D. Develop a standardized set of SMART, specific, measurable, achievable, relevant, time-bound objectives for all counselors, focusing on quantifiable client outcomes such as reduced relapse rates, increased engagement in support services, and demonstrated acquisition of coping skills, with regular review and adjustment based on client progress and counselor feedback. The correct answer is D. Develop a standardized set of SMART, specific, measurable, achievable, relevant, time-bound objectives for all counselors, focusing on quantifiable client outcomes such as reduced relapse rates, increased engagement in support services, and demonstrated acquisition of coping skills, with regular review and adjustment based on client progress and counselor feedback. Explanation. Scenario analysis. This scenario presents a common implementation challenge in substance use disorder treatment programs, translating broad organizational goals into actionable, measurable objectives for individual counselors. The challenge lies in ensuring that these objectives are not only aligned with the agency's mission, but are also realistic, achievable, and directly contribute to client progress, while adhering to the ethical and professional standards set forth by the IC and RC. The risk is that poorly defined objectives can lead to counselor burnout, client dissatisfaction, and a lack of demonstrable program effectiveness, potentially impacting licensure and accreditation. Correct approach analysis. The correct approach focuses on developing SMART, specific, measurable, achievable, relevant, time-bound objectives that are directly linked to client outcomes and counselor performance. This aligns with IC and RC's emphasis on evidence-based practice and client-centered care. By defining specific client progress indicators, e.g., reduction in substance use, engagement in support groups, development of coping skills, and establishing clear timeframes for their achievement, counselors can effectively track progress and adjust interventions. This approach ensures accountability, promotes professional development by providing clear performance benchmarks, and ultimately enhances the quality of care provided to clients, fulfilling the ethical obligation to promote client well-being and recovery. Incorrect approaches analysis. One incorrect approach involves setting vague, aspirational goals without concrete metrics. This fails to provide counselors with clear direction or a means to assess their effectiveness. Ethically, it can lead to a lack of accountability and potentially hinder client progress by not identifying specific areas for intervention or improvement. It also falls short of IC and RC standards for professional practice, which require demonstrable competence and client-centered outcomes. Another incorrect approach is to focus solely on counselor activity rather than client outcomes. For example, setting a goal for the number of sessions a counselor conducts without linking it to client progress. This is a common pitfall that prioritizes process over results. It is professionally unsound because it does not guarantee client benefit and can lead to a misallocation of resources. From a regulatory perspective, it does not demonstrate a commitment to achieving meaningful client recovery, which is a core tenet of IC and RC certification. A third incorrect approach is to set objectives that are unattainable or unrealistic given the client population, available resources, or counselor caseload. This can lead to counselor frustration, demotivation, and a sense of failure, which is detrimental to both staff retention and client care. It also violates the ethical principle of providing competent and appropriate services. IC and RC standards imply a commitment to realistic and effective service delivery, which is undermined by setting impossible targets. Professional reasoning. Professionals should approach goal setting by first understanding the overarching mission and values of their organization, as well as the specific needs of the client population they serve. They should then collaborate with counselors to develop objectives that are specific, measurable, achievable, relevant, and time-bound. SMART. This process should involve defining clear indicators of client progress and counselor performance, ensuring that these are regularly reviewed and adjusted as needed. This iterative approach, grounded in data and client feedback, promotes continuous improvement and upholds the ethical and professional standards required for IC and RC certification. Question 18. Which approach would be most effective in providing immediate support to a client experiencing acute emotional distress and expressing thoughts of self-harm during an initial crisis intervention session? Option A. Employ active listening and validation of the client's feelings, collaboratively identify immediate coping strategies, and establish a safety plan. Option B. Provide a list of potential solutions and encourage the client to choose the most suitable one. Option C. Immediately explore the deep-seated psychological origins of the client's distress to address the root causes. Option D. Refer the client to a crisis hotline or emergency services without further engagement. The correct answer is A. Employ active listening and validation of the client's feelings, collaboratively identify immediate coping strategies, and establish a safety plan. Explanation. This scenario presents a professionally challenging situation due to the immediate and intense emotional distress of the client, coupled with the inherent unpredictability of a crisis. The counselor must rapidly assess the situation, ensure safety, and provide immediate support while adhering to professional ethical standards and the specific guidelines of the International Certification and Reciprocity Consortium, IC and RC, exams, which emphasize client well-being and the counselor's scope of practice. The correct approach, focusing on de-escalation and stabilization, represents best professional practice because it directly addresses the immediate needs of the client in crisis. This aligns with IC and RC core competencies that require counselors to demonstrate the ability to respond effectively to crises, which includes active listening, validation of feelings, and collaborative problem-solving to reduce immediate distress and risk. The emphasis is on creating a safe space for the client to express their emotions and begin to regain a sense of control, thereby preventing further harm and facilitating a transition to more in-depth therapeutic work. An incorrect approach that involves immediately delving into the root causes of the crisis without first stabilizing the client is professionally unacceptable. This fails to adhere to the ethical principle of do no harm by potentially overwhelming a vulnerable individual. It also violates IC and RC standards that prioritize immediate safety and emotional regulation in crisis situations. Another incorrect approach, such as referring the client to another professional without providing any immediate support or assessment, neglects the counselor's responsibility to offer initial crisis intervention and could be seen as abandonment, a significant ethical breach. Finally, an approach that involves imposing solutions without client input disregards the principle of client self-determination, a cornerstone of ethical counseling practice and a key consideration in crisis intervention, where empowering the client is crucial for recovery. Professionals should employ a decision-making framework that begins with a rapid risk assessment, followed by active listening and empathetic validation. The next step involves collaboratively identifying immediate coping strategies and safety plans. Throughout this process, maintaining professional boundaries, adhering to ethical codes, and understanding the limits of one's expertise are paramount. If the crisis exceeds the counselor's capacity, a timely and appropriate referral, coupled with continued support during the transition, is essential. Question 19. The review process indicates a client presence with persistent feelings of sadness, loss of interest in activities they once enjoyed, and significant fatigue. The counselor is considering common mental health disorders that might explain these symptoms. Which of the following represents the most ethically sound and professionally responsible initial approach? Option A. Conduct a comprehensive biopsychosocial assessment to gather detailed information about the client's symptoms, history, functioning, and potential contributing factors, utilizing diagnostic criteria to inform a differential diagnosis. Option B. Ask the client which mental health disorder they believe they have and base the treatment plan on their self-diagnosis. Option C. Immediately diagnose the client with major depressive disorder based on the reported symptoms, as these are classic indicators. Option D. Advise the client that these symptoms are likely due to situational stress and encourage them to engage in more social activities to improve their mood. The correct answer is A. Conduct a comprehensive biopsychosocial assessment to gather detailed information about the client's symptoms, history, functioning, and potential contributing factors, utilizing diagnostic criteria to inform a differential diagnosis. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the counselor to balance the immediate need for support with the ethical obligation to ensure accurate diagnosis and appropriate treatment planning. Misinterpreting or oversimplifying a client's presentation can lead to ineffective interventions, potential harm, and a breach of professional trust. The counselor must navigate the complexities of overlapping symptoms and the potential for co-occurring disorders while adhering to established diagnostic criteria and ethical guidelines. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the client's reported symptoms, history, and functional impairment within the context of established diagnostic criteria, such as those found in the Diagnostic and Statistical Manual of Mental Disorders, DSM. This aligns with IC and RC's emphasis on evidence-based practice and the counselor's responsibility to provide competent care. A thorough assessment ensures that the diagnosis is accurate, leading to an individualized treatment plan that addresses the client's specific needs and promotes recovery. This upholds the ethical principles of beneficence and non-maleficence by ensuring the client receives appropriate and effective care. Incorrect approaches analysis. One incorrect approach is to immediately label the client's distress as a specific disorder based on a single symptom without further exploration. This is a failure to conduct a thorough assessment, potentially leading to misdiagnosis and inappropriate treatment. Ethically, this violates the principle of competence and could result in harm to the client if the actual underlying issue is not addressed. Another incorrect approach is to dismiss the client's reported symptoms as simply stress or a temporary reaction without exploring potential underlying mental health conditions. While stress is a common factor, it can also be a symptom of a more significant disorder. This approach risks overlooking a treatable condition, thereby failing to provide necessary support and potentially exacerbating the client's distress. This is a failure in due diligence and can be seen as a breach of the duty of care. A third incorrect approach is to focus solely on the client's desire for a specific diagnosis without conducting an independent professional evaluation. While client input is valuable, the counselor's role is to provide an objective assessment based on clinical expertise and diagnostic criteria. Relying solely on the client's self-diagnosis can lead to inaccurate conclusions and a treatment plan that is not clinically indicated, potentially delaying effective intervention. This undermines the counselor's professional judgment and ethical responsibility. Professional reasoning. Professionals should approach client presentations with a systematic and thorough assessment process. This involves active listening, gathering a comprehensive history, observing behavior, and utilizing appropriate assessment tools. When considering common mental health disorders, it is crucial to understand the diagnostic criteria, differential diagnoses, and the potential for co-occurring conditions. The decision-making process should prioritize accuracy in diagnosis to inform an effective and ethical treatment plan, always keeping the client's well-being and recovery at the forefront. Adherence to IC and RC standards and ethical codes guides this process, ensuring that interventions are evidence-based and client-centered. Question 20. The analysis reveals that a counselor is working with a new client who presents with general feelings of dissatisfaction and a desire for personal growth, but has not articulated specific behavioral or cognitive issues. The counselor is proficient in person-centered therapy, cognitive behavioral therapy, CBT, and dialectical behavior therapy, DBT. Considering the client's initial presentation and the counselor's competencies, which theoretical orientation would be the most appropriate starting point for establishing rapport and facilitating initial exploration? Option A, person-centered therapy. Option B, dialectical behavior therapy, DBT. Option C, a blend of all three theories simultaneously from the outset. Option D, cognitive behavioral therapy, CBT. The correct answer is A, person-centered therapy. Explanation. This scenario presents a professional challenge due to the need to select a counseling theory that aligns with the client's presenting issues and the counselor's ethical obligations under the IC and RC framework. The IC and RC Code of Ethics emphasizes client welfare, competence, and the use of evidence-based practices. Therefore, the counselor must demonstrate an understanding of various counseling theories and their appropriate application. The correct approach represents best professional practice because it demonstrates the counselor's ability to critically evaluate different theoretical orientations and select one that is most likely to be effective for the client's specific needs, while also considering the counselor's own competencies. Person-centered therapy, with its emphasis on empathy, unconditional positive regard, and genuineness, is a foundational approach that can be effective in building rapport and facilitating client self-exploration, particularly when the client's specific issues are not yet clearly defined, or when the client expresses a desire for a non-directive therapeutic relationship. This aligns with the IC and RC's focus on client-centered care and the ethical imperative to provide services that are beneficial and respectful of client autonomy. An incorrect approach would be to rigidly apply a theory without considering the client's unique presentation or the counselor's expertise. For instance, immediately defaulting to a highly structured approach like cognitive behavioral therapy, CBT, without assessing the client's readiness or willingness to engage in cognitive restructuring could be premature and potentially alienating. This could be seen as a failure to adhere to the principle of client welfare, as it prioritizes a theoretical framework over the client's immediate needs and preferences. Similarly, choosing a theory solely based on the counselor's personal preference or limited training, without a thorough assessment of its suitability for the client's presenting problem, would violate the IC and RC's ethical guidelines regarding competence and the obligation to practice within one's scope of expertise. This could lead to ineffective treatment and potential harm to the client. Another incorrect approach would be to avoid theoretical grounding altogether, leading to a haphazard and potentially unfocused therapeutic process, which would not align with the IC and RC's expectation of professional, evidence-informed practice. The professional decision-making process in such situations involves a thorough client assessment, including understanding their presenting problems, goals, cultural background, and preferences. The counselor should then consider their own theoretical orientation, training, and experience, as well as the evidence base for different therapeutic approaches in relation to the client's issues. A collaborative approach, where the counselor discusses potential therapeutic pathways with the client and jointly decides on a course of action, is also crucial for ethical and effective practice.